The first question the pregnant mother asks is, what can I eat? I tell them, see, pregnancy is not an illness. So you eat normal food. But then most of the people, even most of the people who are very well educated, do not know how a normal food habit should be. And during pregnancy, they are more worried because there is a fetus inside. So that nourishment also has to be taken care of. The basic food habit for any person is determined by what is called as a food pyramid. This pyramid should be followed by all people, young or old, women or men, pregnant or non-pregnant, whether you are overweight or underweight. But the quantity will vary, the requirements will vary depending upon whether it is a child or an old person or a pregnant mother, or whether it is an idle person or a person who is doing lot of manual work. Okay. And during pregnancy, another problem is in the first 3 months there is lot of vomiting. So because of vomiting, the woman may not be able to take what we advise. And also there are food fads. Some foods they may like, some foods they may not like. But as much as possible, the pregnant woman should try to follow the food pyramid. What is a food pyramid? It is like a formula. The food substances can be arranged like a pyramid. The base of the pyramid is formed by cereals. What are cereals? Rice, wheat, ragi, maize, oats, all this forms the base of the pyramid. These cereals can be cereals as such or their products. For example, if it is wheat, it can be wheat flour, wheat as such, or rava or maida, any of these. So, and their products. This should be about 65% of the total content of the food. When I say 65%, you will be wondering how much of 65%. So, it is easier to remember that it should be between 7 to 9 servings per day. When I say a serving, it can be 1 chapati or 1 cup of 1 scoop of rice or 1 scoop of oats or 1 scoop of ragi flour. So that is a standard one. Say 1 idli is 1 serving. So it should be between 7 to 9 servings. In this again, you should know what to eat, how much to eat and how to eat. First let's take what to eat. In case of rice, there are varieties of rice. There is brown rice, there is boiled rice, there is white rice. The brown rice is the best. Then comes the boiled rice. The more polished and unboiled the rice is, the more carbohydrate it will contain and less fiber. Similarly with wheat. When you take wheat flour, when you go to shops, you choose a wheat flour which is called as whole atta, where they have not removed the fibers. If the fibers are removed, then it becomes rava and maida. This rava, maida, etc., they do not have fibers, they have only carbohydrate part of it. So they will have more calories weight by weight when compared to a whole wheat atta. And when you take oats, instead of taking oats kanji, okay, it's always better to have oats with a little dal and vegetables. Then only it will be good. The oats contain what is called as soluble fibers. Okay, it is good, but even that, if taken as kanji, which is easily digestible, it is not as good as it is when it is taken along with vegetables and maybe like a porridge. Then all the other items, depending upon the place, the geography, people may take maize and ragi, etc. These also should be taken in limited quantities. See, I told you what to take and then how much of it to take. I told you 7 to 9 servings. And then how to take. I said the form in which it should be taken. So, it should better in a solid form than in a liquid form like kanji. It is better along with a dal and a vegetable, and it is better in the boiled form than in the fried form. And during pregnancy, these things should be taken in small quantities frequently. Also, it is better to make it as a variety rather than as like rice all the 3 times. Maybe if you take idli in the morning, then afternoon maybe you can take rice, night chapati, or oats in the morning, afternoon rice and night chapati, or night ragi, like that. You can keep changing, which is good. Most of the cereals are equally have almost equal amount of carbohydrate and fibers, except I said oats has a little soluble fiber, a little extra, and the amount of carbohydrate between rice and wheat may be about 2% difference. Rice may have 7% and wheat may have 5%. The next layer is vegetables and fruits. See, you always listen to people take lot of vegetables and fruits. It doesn't mean that you can take all the vegetables and fruits in the equal amount. Even in these vegetables and fruits, there are things which can be taken in plenty. There are vegetables and fruits which have to be taken only in limited quantities. There are vegetables and fruits which are in between. So let's take vegetables first. In the vegetables, green color vegetables with fiber can be taken in unlimited quantity. How do you know that a vegetable is having lot of fiber? Any vegetable, if boiled, if cannot be smashed into a pulp, then it is a vegetable with good amount of fiber. Example will be beans, cluster beans, avarekai, kottavarangai, all these vegetables. Okay. Even greens, green leafy things also come under this category. The second group of vegetables are vegetables which contain a little less fiber and a little more of carbohydrate. These will be like chow chow, plantain, raw plantain, all these things. So, how do you identify them? Like if boiled, of course, they cannot be smashed into a pulp, they will have a little more solid things in them. And the third group of vegetables like potato and its group. These vegetables have lot of carbohydrate and less fiber. These vegetables should be taken in limited quantity by people who are normal weight, and if the person is obese or diabetic, these vegetables should be avoided, that is potato and its group. I should make a special mention about sprouts. Of course, sprouts can come under the dal category also, but it is mostly available in the vegetable shop. The sprouts can be taken every day, they are good. In fact, in food, we should develop the habit of having salads every day. Salads can be formed by cucumber, carrot, anything which can, sprouts, which can be taken raw. Then I mention about coconut. Coconut again in limited quantities is good. If taken in excess, it contains carbohydrate and fat. So, if taken in large quantities, it can again produce obesity. So, coconut is good in limited quantities. See, for that matter, any food substance, whether, you don't classify them as good or bad. If I say something is good, it doesn't mean then you can take them in large quantities. If I say something is bad, it doesn't mean that you have to 100% avoid that vegetables. If it's good, it means that you can take them liberally. If it's bad, they usually contain less fiber, so take them in limited quantities. Now, let's go to the fruits group. In the fruits also, not all fruits are equal in their calorie content. Okay. Some fruits contain more calories weight by weight. For example, if you take bananas, mangoes, jackfruits, sapota. All these fruits have more of carbohydrates and should be taken only in limited quantities. The other fruits like grapes, pineapple, etc., they come in the in between category. They have a little less carbohydrate than the other fruits I mentioned earlier, and a little fiber also. The other fruits like apple, orange, goya, papaya, all these fruits have good amount of fiber and vitamins. They can be taken in moderate quantities. The number of servings for vegetables should be 3 to 5. Say that should be like morning one vegetable. Say supposing you are having idli, have sambar with vegetables, or you are having oats, you have vegetable salads. So that will be one serving. In the afternoon with sambar you will have some vegetables. Then if you have some side dishes, there should be at least 2 or 3 vegetables. Again night along with chapati you can have some vegetables. Similarly fruits also, there should be at least minimum of 2 to 4 servings per day. One serving will be one small katori or cup. Then comes the next layer, the protein layer. In the protein layer we have the vegetarian group and the non-vegetarian group. In the vegetarian group we have dal, pulses and milk products. In the dal again you make it a variety. Instead of taking the same dal every day, you take different kinds of dals. And when it comes to milk and its products, you remember now pasteurized milk are available. In this there are 4 categories now, even in the almond milk that is available. There is a packet which is with 1.5% fat. There is another one with 3%, another one with 4.5%, another one with 6%. Okay. People who are obese should avoid the ones with 4.5% and 6%. People of normal weight can take the 3% milk, and people who are in the underweight category can take the 4.5% and 6%. The 1.5% milk is for people who are obese. Even though the milk contains calories, fat, etc., the calcium and the proteins in that are necessary, especially for vegetarians. So even if people are obese, they can take milk with less fat. At least about 3 glasses of milk will be required per day. If it is 3 glasses, it includes the milk as such, or the coffee, tea, or the curds that you take. Along the milk products you have paneer. Okay, this also gives good protein. Non-vegetarian group, for the proteins we have what is called as red meat and a white meat. Okay. What are the white meat category? The fish and the chicken comes under the white meat category. Mutton, beef, pork, all that comes under the red meat category. The red meat are red to look at, and the white meat are little pale to look at. In this again, see the white meat, how to remember which will belong to the white meat. Of course, to look at you know the difference. The other thing that you can remember is any animal which keeps moving constantly. See, for example, have you ever seen a bird resting continuously, or have you ever seen a chicken sitting at one place for a long time? No. Similarly, fish. These things keep moving constantly, so they don't store fat in their body. They have good proteins without much of fat. Whereas look at the cattle items, goat, beef, a cow, etc. All these things usually they stand at one place for a long time and eat a lot. So their immobility makes them store a lot of fat in their body, especially even in this red meat. The meat belonging to the limbs will have less fat, than liver, spleen, etc. All these liver, spleen and all will contain more fat in these animals than their muscular part. The red meat should be avoided by people who are overweight and diabetic. The lean meat can be taken, lean meat is white meat, can be taken twice or thrice a week by anybody, normal people or even the obese category of people. This protein should be about 15% of your diet. 65% I told you carbohydrates, 15% fruits and vegetables. So that comes to 80%, another 15% by proteins, that is 95%. Then there is another 5%. This 5%, 3 to 5% should be formed by nuts and certain dry fruits also can be taken, nuts especially groundnut, badam, pista. These things should be taken sparingly. Oil also comes under this category. Okay. Oil and nuts should be taken sparingly. It is about less than 5% in the whole food content. So, oil should be used only to season the vegetables and not to fry. So, you should avoid fried items which will contain lot of fat. And the last layer that we see is the things that should be avoided, the topmost portion of the pyramid, that is formed by sweets, artificially sweetened drinks, bakery items, ice creams. All these things come under this category. If you see, all these items are man-made, they don't occur in nature. These group of things they are not good for anybody, young or old, thin or fat. These food substances are not good for anybody. They should be avoided by any person who wants to lead a healthy life. The last category of foods that we were discussing, like the ice creams, sweets, etc., they give what is called as empty calories. What do you mean by empty calories? I'll just give you an example. See, if you give a mason 1 kg of cement and 1 kg of cotton to build a house, what he will do? Both may be weighing 1 kg, but he'll throw away that 1 kg of cotton and use only the cement. Similarly, the body, if supplied with calories which are of no use, it will dump it as fat. For example, all this artificially flavored drinks which comes in different colors. For example, they give about half a liter bottle will give you about 360 to 400 calories. And you should also know about foods which have a high glycemic index. What do we mean by that? Any food, if taken, if it can rise the blood sugar within a very short time, then it is a food with high glycemic index. For example, you take a fruit juice with lot of sugar or a kanji. The sugar levels in these conditions will go up immediately because there is nothing to digest. It is easily digested. So, immediately the sugar content in these food substances will be taken up by the blood and the blood sugar level goes. Once this blood sugar level goes up high, what does the body do? To protect the body from the ill effects of high blood sugar, it secretes more of insulin and then removes these sugar from the body. And then once the sugar is removed from the body, again the body feels hungry. So what happens? You tend to eat very frequently with high calorie foods. Anything which is easily digestible will have this high glycemic index, and so actually even fruits should not be taken as fruit juices but only as fruits. Don't take as kanji but take in the solid form. Take time to chew and eat. In general, during pregnancy, you may need about 300 calories of food extra. 300 calories means it may be 1 idli, 1 banana and 1 glass of milk. For this, people think that they have to eat for 2 people. It is true that you have a baby inside, you are 2, but you don't have to eat for 2 adults. The baby inside is so small, doesn't need as much nutrition as you need. So please don't try to overeat. And especially in the first 3 months, many people tend to lose weight because of the vomiting. They may not be able to eat what we tell as the normal food pyramid. These people can eat what they like, but even then they should avoid those things which I said should be avoided, like the sweets, cool drinks, ice creams, fried items, etc. And the pregnant mothers also should avoid too much of caffeine. Caffeine is in the form in coffee, chocolates, etc. This too much of caffeine sometimes can produce restlessness and irritability. So better avoid it or to be taken in limited quantities. The mothers also don't need health drinks unless they belong to the underweight category. Many women think that they should take extra nutrition, so even if they are overweight, they tend to take all those health drinks that are advertised. If you are taking a normal diet, there is no need for any health drinks. Try to eat small quantities at frequent intervals. Don't overeat, never starve. That's the dictum during pregnancy. If you follow the food habits and the food pyramid that I am saying, you will not even have this gastritis, indigestion, constipation, all these problems. These problems also will be solved by a good food habit. Then you should know what are the vitamins and minerals that you should take during pregnancy. The most important supplement during the first 3 months of pregnancy will be folic acid. In fact, we give along with that what is called as DHA also. This folic acid is important for the neural development of the baby. It should be taken by the mother even before she becomes pregnant and till 3 months of pregnancy. After 3 months of pregnancy, definitely all the iron supplements will have some folic acid, so they don't have to take separately. This folic acid and DHA, it is better they take during the first 3 months of pregnancy, even if they have lot of vomiting. And after 3 months, we usually give iron, calcium, omega-3 fatty acids and vitamin E. The iron is the most important supplement. The Indian diet is not favorable for iron absorption. So iron supplementation is a must for the hemoglobin to remain in the normal levels. Food substances cannot supplement this iron content satisfactorily. The iron does not produce black babies. It does produce black stools for the mother, but it does not color the child. So you don't have to worry that your child will be black if you take iron tablets. If you are not able to take tablets, you can take them as syrup or injections. Then comes calcium. Calcium is very important for the bone strength of the fetus and the mother. You need minimum of 1000 milligrams during pregnancy. Again, calcium supplementation should be done for Indian mothers, because most of them, even though India is a sunny country, many of the women keep themselves covered. When you cover yourself from sunlight, you have little calcium deficiency. So calcium supplementation also is a must as far as our country is concerned. Then comes vitamin E and omega-3 fatty acids, which are good for the brain development of the baby, and also it helps to some extent to prevent increase in BP in the later months of pregnancy, and also the cramps that occur during later months of pregnancy.